I'm honored to be able to share Nevada's outlook on healthcare with this group and with Nevada. Obviously, that's been an interesting year for us in 2020, and no one could have predicted what that would look like for all of us. Focusing on healthcare, what I'd like to do to share with you today is really to share with you a framework of healthcare, as well as the view of the state of Nevada, the status of Nevada in healthcare, the impact of COVID, as well as a forward-looking view of healthcare. With that, I wanted to share with you and start off this discussion today as relates to healthcare improvement or the framework of healthcare. This is known as the triple aim in many circles, but this framework of healthcare looks at three key components. One is providing better access to people wherever they may be in the state, whether it be in urban areas, rural markets, or wherever they may be. Two is providing better quality for them, as well as then the third piece of this triangle is cost improvement or providing healthcare for less cost. In healthcare, we follow this strategy. Again, we call it the triple aim. Overall, this goal builds accountability for us as healthcare providers. We have the responsibility to our communities to provide this triple aim of cost, quality, and access. In the state of Nevada, we do definitely have some challenges, as well as we've seen some successes. In Nevada, we have some legislative improvements that occurred in the 2019 session, which we'll discuss. However, in Nevada, we still have challenges in regards to access to appropriate healthcare. Nevada continues to rank very low and near the bottom in several areas. One is access to mental health, access to primary care providers. Nevada ranks 48th in the United States as it relates to population and healthcare providers on the primary care side. Also, in the legislative session in 2019, we did receive some, I think, positive legislation as it relates to price transparency and surprise billing. Surprise billing, for example, addresses the issue where a patient accesses healthcare at an emergency room where they're out of network. In those circumstances, on occasions, the patient would be billed a differential for what was covered and what was not. Fortunately, under this legislation, patients are able to go to virtually any emergency room and be protected with this legislation. In regards to Medicaid, the concern with Medicaid is that a number of patients who have Medicaid are unable to access healthcare in many traditional settings, whether it be on the primary care side or the urgent care side. Fortunately, we do have a backdrop of supportive services through federally qualified clinics such as HOPES, the Nevada Health Centers, and the Healthcare Alliance, which has been phenomenal in their support for Medicaid services. This next slide is interesting, and we've seen national news as it relates to the pandemic. Here, this is a slide that shows you the trend for the pandemic impact on hospitalizations with COVID. As we can see early in March, and then you can see the trend with a small uptick in May, but then you see a bigger surge of hospitalizations in the summer. And now, as we're all experiencing a very big surge in hospitalizations for the wintertime. It is different from the south part of the state versus the north. And with that, we see that the south does struggle from a much bigger surge in hospitalizations, whereas the north, in fact, the trend as we see just over the last week or two has decreased. And so we're very grateful for that. Obviously, with this surge, it does test our capacity for hospital care for our markets. As you know, I am the new CEO for Sierra Medical Center. We wish this hospital would have been in place early in the pandemic so we could have provided relief for our customers. The pandemic and its impact on healthcare. Obviously, this has impacted us in many negative ways, also in a few positive ways. Obviously, with the impact in healthcare, we see that there's a sharp decline of patients using traditional services, such as a primary care physician or the hospital. And unfortunately, we see that much of care was delayed because of choices to not access care. And so what impact that had was that patients came in a more critical nature into the emergency rooms rather than managing their conditions with their primary care for their chronic conditions. So it was definitely a negative impact. We also see that mental health was dramatically impacted. I don't like the word or the term social distancing. I prefer the term physical distancing with increased socialization. We've seen an increase in mental health issues, increase in suicide attempts and suicides, as well as depression and other challenges for youth as well as older adults. Obviously, we've all been impacted by job losses and the impact to the economy, which not only impacts their jobs, but impacts access to healthcare as well. On the flip side, we did see an improvement in the use of telehealth services. Telehealth is not new. In fact, we've been using it for many years. But the increase in the use of telehealth services has dramatically increased the access and the capability. Obviously, going forward, we'd like to see this access to telehealth, whether it be mental health, primary care, cardiology, neuro health, et cetera, continue to be utilized and in fact increase, because that addresses one of actually several issues of the triple aim, which is cost, lower cost, better access, as well as addresses quality. Some of you still may be wondering about the pandemic and healthcare. What I wanted to do is share with you a little bit about the tiered strategy for vaccinations. First tier is for healthcare workers, Department of Corrections, law enforcement, and state and other EMS emergency services professionals. I've received actually my first tier step 1 vaccine, a little soreness in the arm, and I received my next vaccine shortly. So far, so good, and I'd recommend we all receive it. Tier 2 is education, childcare, agricultural supply chain, and many others, as well as the elderly that are 75 and above. Again, those are one of the most vulnerable populations, and again, would recommend people receiving the vaccine. In Tier 3, we see individuals with underlying healthcare conditions, as well as people from 65 and older, as well as homeless and other compromised individuals. And then Tier 4, for the most part, the rest of us from 18 and up. And again, I would highly encourage people to receive the vaccine. As a comparison, people who receive the flu vaccine are about 50%. We would encourage all people to receive the coronavirus vaccine unless otherwise permitted. Next, I'd like to share with you looking ahead in Nevada healthcare. I've already shared with you that Nevada ranks very low, 47th in mental health access, as well as 48th in primary care per population. So looking ahead, we must focus on primary care shortages, increasing primary care providers, the utilization of advanced care practitioners such as nurse practitioners, as well as physician assistants. Also, as we address this triple aim strategy, cost, quality, and access, the need for the growth of ambulatory care expansion. So if you don't have to go to a big hospital, why not get it at a small center that does the same thing or is good or better quality, better cost, as well as great access? So centers such as ambulatory care centers, telehealth, and other ways are ways to increase ambulatory care. I mentioned telehealth multiple times, and I'll say it again. The adoption and the spread of telehealth is critical for the advancement in healthcare to address the triple aim of cost, quality, and access. Ultimately, continuing looking ahead in Nevada in healthcare is that we must focus on the critical healthcare needs to improve patient experience, enhance the health of our populations, and reduce those costs. In Nevada, we're experiencing many shifts in the industry that will force us to adapt operations so we continue to focus on these three things: cost, quality, and access. The technology continues to move forward, and we must do the same. One of the key changes in healthcare that we've seen recently is, and actually this goes back generations, for value-based care. Nevada is a little bit laggard in its focus on value versus volume, but there's some great examples of value versus volume. So volume, people used to be paid by how many patients they were able to care for. Now, people are being incentivized, providers and institutions, on the value they provide. So a great example of this is called an ACO, an Accountable Care Organization. This is an organization that contracts with Medicare for a price to provide those three things that we started this presentation on: cost, quality, and access. One of the best examples I can think of is this Silver State ACO. How apropos with our state. They have had an ACO with partnerships and agreements with many providers in the North and the South and many markets in our state, and have been highly successful in addressing these areas of cost, quality, and access. With this, physicians partner and are incentivized for achieving these three goals. And so another advancement in ACOs is a win for our state. Obviously, the shortage in Nevada is again a focus, not only for providers, of nurse practitioners, of other physicians and other providers, but also in nurses. We need to find ways and recruit nurses in from other places to support our state in its growth, as well as focus on telehealth, as well as ambulatory care networks. So as we look forward, our state, I believe, is in very good hands. We have our challenges, but we've shown our resiliency to move forward in addressing cost, quality, and access. Thank you for this opportunity to share my thoughts with you today.